If you've noticed, and we talked about it a little bit last week, the daily report has been redesigned to reflect the statewide metrics, including the positivity rate. Remember, our goal is to keep that below 20%. I've had people ask, how do we calculate the positivity rate? Well, if you add both the positives and negatives together, and then that's your denominator, and use, for those of us in math, the numerator at the top is the positives, and you can get the positivity rate. But it's a rolling rate, so every day you'll see it fluctuates, but again, we've been below 20%. You'll also see the hospital capacity, which includes our intensive care units and our med-surg beds. It becomes important to understand that that comes off what's called the EM Resource Board. We talked about that, and it really talks about what is the capacity of our hospital to care for us. And right now, hospitals are asked to keep at least 14% of the capacity available for treatment and management of COVID. The new graph that was added last week is on the back side and talks about hospital admissions for COVID-19-like illness. And again, you'll see that fluctuate. And remember, we talked about that last week, but really it's a kind of a measure from the hospital admissions and emergency departments. It's gathered at the time. Doctors don't have to do anything special. It's through a system called Essence, which is a national surveillance system. So it's not reliant on anyone reporting a particular number. It automatically gathers every day. And it gets updated, and you'll see the numbers fluctuate there as well. I've asked, why does it change from day to day, even on a day prior? Is because then as the admission data becomes coded to COVID-19, you'll see that change. And then it's the testing capability. And we'll talk a little bit more about the testing capability guidelines changed last week. So we can talk a little bit more about that, as well as contact tracing. If you listen to the governor today and Dr. Duffus, you heard about the importance of contact tracing. And here in Winnebago County, we've talked about this. And we initiate contact tracing within 24 hours of the test result. Not the time you've taken the test, but the test result coming to us. Because I often hear, well, I had the test yesterday, no one's contacted me yet, and it's not until the test result drops to us in the system. So again, we begin that within 24 hours. And last week, we introduced you to the Medical Reserve Corps. That includes medical students and volunteers, physicians from our community, along with our full-time disease investigation staff, who contact you to identify, if you're a positive case, who you've been in contact with. So as we move forward, this becomes even more critical so that we can identify infections quickly, promptly, and isolate them in the community. Testing is the other part. We want rapid testing capabilities. So last week we learned that testing is available to anyone with signs and symptoms of COVID-19. That has not changed. Contacts to individuals with COVID-19, so household contacts. This is kind of a reminder of the group that who has been quarantined at home with someone, a family member who has been tested positive, to get tested. Those with underlying health conditions. That's an expansion to a new group. Those people with high blood pressure, diabetes, heart disease, things like that should also consider getting tested. Immunocompromised, so it becomes important for those individuals as well. Healthcare workers, including long-term and congregate setting providers. First responders. Essential workers, those are the individuals that are providing transportation, logistics, our superheroes in the supermarkets that have been providing this all along to us. Any kind of an essential worker. Children and adults, I've heard this. Can children, we've talked about this before, get COVID-19? We're learning more about a syndrome that's an inflammatory condition that children are more likely to get. And yes, children can be tested at our community-based testing site. If you're unable as the parent to swab the child at the site, then the guard will help you on that, and Crusader has medical care professionals that will help on that. And all residents, regardless of citizenship status. That's another question that's routinely asked. Do you need to be a citizen? And as of last week, you are not required to provide any kind of photo identification. We understand that some individuals were showing to the sites without a photo ID, and so right now, again, it is not a requirement, but we do ask people because it does help us make sure that we have accurate information, so when we do follow-up, we know what individuals were tested. So important to understand, we continue to have a lag in some of our results for those individuals who were tested at the University of Illinois Health Sciences campus through the Illinois National Guard from April 24th through May 6th. During that time frame, a total of 2,466 specimens were submitted. Approximately 500 results are still pending, but we received a file at approximately 2:30 today, right before this time, and so we will be working through that file to reconcile the remaining results that we have in that file. So we have taken down numbers. If you have called us through the COVID-19 hotline, sent us an email, and we will be following up. And again, we will be notifying individuals of their results. And again, providing guidance. If you're still symptomatic, you may still be recommended to have another test. If you're asymptomatic and have cleared, we will give you additional guidance on that. Or if you're in a sensitive occupation that we think that warrants another test, we will work through that as well. So with that, I want to talk about our numbers for today. New cases, we have 57 new cases being reported. They're aged from less than 1 year of age to up to 100 years of age, for a total of 1,558 cases. Over 16,000 tests, almost close to 6% of our population has been tested, so our community has definitely got the message about the importance of understanding the disease prevalence. Remember, we were going for a minimum of 5%, so it's good to know that people have been testing and continue to get tested. And 395 cases are reported as recovered. We are also reporting 2 new locations of concern. These are congregate settings in which we know infection rates can spread rampantly and have a higher mortality rate, which is Fairhaven Christian Retirement Center and Luther Center. And again, our long-term care congregate setting strike force team is working with those sites to make sure that they're reviewing procedures and policies about how to lessen the spread of the infection, as well as make sure that they have adequate personal protective equipment, or PPE. So as we move forward, and you hear the numbers, and yes, the cases are growing, and yes, we continue to monitor, we are on track with the rest of our region, including Region 1 in Northern Illinois and the North Central region of Illinois, as we are now part of the Governor's Plan and Restore Illinois, to enter into Phase 3 of recovery. And I keep reminding people we are going to coexist with COVID. We are not going to get to a 0 infection rate. And even when we have vaccine, I know it'll be hard to get to that as well. But we're going to have to learn how to keep our infection rates down. I understand that people are quarantine weary at this point, that people are angsting to get out, that they want to return to life as normal as they knew it. However, we are going to be really coming out and really wanting to ramp that out so we can recover and restore in a way that's thoughtful, that identifies infections quickly, that does not result in us having to close back down again. We're going to have to learn to do things differently. Our current social distancing score over the weekend was an F. So meaning that people are probably still struggling to stay home as much as possible. But we need to stay the course. We have roughly 2 weeks remaining. We want to get through this so that we don't jeopardize our entry into the next phase. And it does require all of us. We have to be identifying what we can do to make that. It's our responsibility. I heard over the weekend about enforcement and law enforcement and penalties and fines, but at the end of the day, we have to decide that we want to move into the next phase, that we want to be able to restore our businesses, that we want our children to be able to return to summer camps and be able to ready to see what that looks like as we approach the fall. So it becomes important that we understand we're in the final I'm going to say final mile of this portion of the marathon, but it is our duty and our responsibility. It's important not only for yourself, your family, others, but your essential workforce and those around you. So you still are encouraged to limit essential trips, but I remind people that health care, dental care, mental health care are essential trips and do require every single one of our healthcare provider systems, and you'll hear from Dr. Cole, is prepared to care for you in this, coexisting with COVID in an environment that protects you. Know your contacts. I know this is sometimes we're used to being able to anonymously go someplace, not even recognize who's sitting around us or next to us. But when we talk about that contact tracing and you get that call, you're going to have to think about, who was I around? What was I doing that day? Who could I have possibly exposed? So you can't really just be ignorant to those facts. You're going to have to think about it. We have to do things a little bit differently. Our community, including residents, businesses, services, We're all depending on each other and individuals to do the right thing, even when no one is looking. We got to do the right thing for the right reasons. So next, I'd like to introduce Dr. Cole, who is a trauma medical director at Swedish American Hospital and has been the advisor at the Incident Command Center for the past 2 months responding to COVID-19 at Swedish American Hospital. He has been involved in the planning, operations, and delivery of care to both COVID and non-COVID patients throughout the beginning of the pandemic here in Rockford. I also want to acknowledge him. He was also instrumental in working as a lead with our health systems to develop the guidelines for resuming elective medical procedures within our community.